Remember when the US slashed its foreign aid in early 2025? This was not unintentional. This was the US pushing its own agenda. It was not chaos, it was a reset. To what? America first. On the 18th of September, the US government launched the America First Global Health Strategy to protect the American people. They claim that this strategy uses global diplomacy and foreign assistance to make America safer, stronger, and more prosperous, and end inefficiencies, waste, and dependency of their current system. But listen carefully how. This strategy says that the US will monitor disease outbreaks in other countries as early as possible to protect Americans. So the strategy goes on to say that the US government will screen every person traveling to the United States. And additionally, they will create a profile of every traveler entering their country. This technically also means that the US government will have access to our medical history, our travel history, and who knows what other personal information they will have access to and collect. Now, it's important to note that this is not just a public health concern, but one with heavy emphasis on surveillance, the US presence in other countries, and for them, it is the US priorities coming first. This is not about global solidarity. It's not about unity. It's not about holding hands and singing Kumbaya, but it's about early warning systems for the US built in other countries' health systems. A major red flag, major red flag. What I found interesting with the America First Global Health Strategy is that the support model is changing. And by this, I mean that through this strategy, the US will not work with community clinics, with NGOs anymore. So technically, they're discrediting and sidelining, disrespecting even NGOs, CSOs that have for a long time served vulnerable and marginalized communities. But they will rather heavily focus on working with governments, working with the private sector, and working with faith-based organizations. Now, that's important to note also, because remember what Trump had also said about American values when he came into power early last year, and what that means, especially for vulnerable groups, for marginalized communities across the world. Now, this shift in support and the way that they will be operating really matters because many marginalized groups really depend on NGOs, on community organizations, such as drop-in centers, to access healthcare with the knowledge that, with knowing actually that there will be privacy and issues around trust will not be of concern for them. As of January 2026, 15 African countries have signed the America First Global Health Strategy Memorandum of Agreements with the US government. These include Botswana, Eswatini, Kenya, Lesotho, Malawi, Nigeria, and Uganda. I think what we all need to be aware of is that our governments are not just signing onto ordinary health aid. That is not what is happening here. They're signing up to a system which health information, disease monitoring, and reporting structures are directly tied to US priorities, policies, and practices. This really is not just health funding. It's funding that comes with conditions, with loads of control, with data flows largely benefiting one government. And that is not our government. It is not any of the African governments that signed these MOUs. We know who this largely and mainly benefits: the United States. In our next series of videos, we will explore exactly what it is that our governments are agreeing to in these memorandum of agreements, what is in these MOUs. So please do share your thoughts, share your comments, and do subscribe to the Southern Africa Litigation Center on all social media platforms.